My name is Kelly Reedy. I have my master's and my bachelor's degree, and I'm an athletic trainer. If for my athletes that don't already know me, my name is Kelly Reedy. Believe it or not, I graduated Bethel Park High School 10 years ago. So at one point in time, I was, well, not sitting in this school, but I was sitting in one of high school classes just like you guys. At first, I was like, I want to be a doctor. I want to be an orthopedic doctor. So I was like, oh, I'll do that. But then when I got into my athletic training, I realized I can spend more time with what we call patients or athletes in a setting. So I'm going to kind of go over that. So what are athletic trainers? Besides my athletes, does anyone else here have a clue what we do?
You train. You help people that are injured get back there.
Yeah, good. You guys can't answer it because you kind of know, but anyone else? That, I'm going to get to that, yes. We actually do help save money. Another reason we're here is to obviously protect the athletes, make sure you're safe. So we are healthcare professionals that we're preventative. So a lot of times you'll see, like Bob or I, during the summer, we do preventative training. So what we'll do is we'll help to prevent ankle injuries through ankle stabilization exercises like, and I'll get to some of that in a little bit. But we do a lot of preventative stuff. We do emergency care. So if someone breaks their ankle, that's what we do. We can't officially diagnose, but we do evaluate people's injuries, and if they need to go see a doctor, we'll let them know. If they don't need to go see a doctor, we can let them know. We do rehab with people. That's what therapeutic intervention is. And we also do modalities. This is one of the cool things, okay? This is called an H-wave, okay? So if you're having muscle pain, we can actually hook this up to you and help take away some of your muscle pain. This is something PTs also use. So we have a lot of stuff down there to help get you back to sports faster, to help get you healthy, and to keep you guys safe. If you guys want to pass it around, I'll actually let you pass it around. We can't use it. No, we can't use it, but I'll pass it around so you can look at it. Don't turn on any of the buttons, okay? It's similar to that. It's called an H-wave machine. It just came out, so just be careful. Yeah, it does that. So therapists also use that too. Okay, so more than 70% of athletic trainers have their master's degree. I have my master's degree. I got it. I went to undergrad at Ashland University. A little bit about me. I got my master's degree at Georgia Southern. Not only did it give me time to work with collegiate athletes, but also gave me practice for working on my own. So I had other people around me. So, okay. So we're like PTs and EMTs. We do the rehab therapy like the PTs. We do the modalities like to help people get better. And we do emergency stuff like EMTs. However, we have further training than EMTs. We can do orthopedic stuff like orthopedic testing to see if you have that broken bone. EMTs can't. So like if you tore your ACL, I know if you tore your ACL, EMTs can't do that. So we work under the supervision of doctors. Has anyone here met Dr. Shulkin? No? He's awesome, but he's our team physician, and I work underneath him. I practice underneath him. Okay, so we're not personal trainers. Please do not call me a trainer. I'll answer to it, but personal trainers, some athletic trainers have that credential, okay? They go on and have some more schooling to have that credential. But otherwise, we don't do just personal training. We don't help athletes like exercise and stuff like that. Please don't call me a trainer because that can mean a personal trainer, a dog trainer, a line trainer, whatever. I'm an athletic trainer because that's what I do, okay? So again, some personal trainers don't have the 4-year degree. They don't have any credentials. Whereas I actually, I have a bachelor's degree, okay? So I went to school for 4 years in a curriculum with athletic training, okay? Some people will go to undergrad and you say, you want to be a biology major. and then they'll go and get their master's in athletic training, and then they are an athletic trainer. So, okay, so this is a certification. Every program has to be certified by that long letter committee called CATIE. It's called CATIE, and you can be an athletic trainer and a personal trainer. Again, you just have to get the credentials. So who here now thinks they want to be a personal trainer instead of an athletic trainer? Okay, you're probably just saying that right. Okay. Okay, so we have to go through this board to get certified. So what does that mean? Who here has taken the SATs? You guys? It is harder than the SATs. Okay, you have to study for it your senior year, and you have to take the test. Okay? If you don't pass the test, you're not an athletic trainer. You have to keep taking it. Okay? And then we have to go through the state board of medicine like doctors do and PTs to be licensed. Okay? So every state except the state of California, we have to be licensed. So I have my certification, I have my master's degree, and I have my licensure. Okay?
Do you have to have a master's degree, or can you?
No, you can go in with a 4-year bachelor's. Yeah, I just did it to get the experience and to also work at the collegiate level. So what do you guys need to learn? What do you guys think you need to learn over here? What do you think is important when you're dealing with injuries in athletes for schoolwork? Yeah, well, I mean, we're going to get to that. Okay, you need to take an emergency care class. Good. Anything else?
No, when they're just laying on the field because they're mad and when they're actually hurt.
Well, think of what schoolwork you guys need to do. What? Yes, Sanger got it. Anatomy, that's another one. Okay, so we also have evaluation class. We evaluate injuries. We learn how to evaluate injuries like orthopedic doctors do. We have a modalities class that modality I passed that it shows you how to use them and why you're using them, why you need to use them.
What's a modality like that?
It could be like as anything that helps someone get better quicker or relieves their pain. So could be ultrasound or like STEM or that H-wave machine. It could be anything like that. Okay, so it's anything that helps you get better quicker, relieves your pain. And then we also have to take sports nutrition class and stuff and rehab classes. So I don't know if you guys know this, but it's actually a lot of time. Like you have to have 15 hours a week shadowing an athletic trainer, helping an athletic trainer so you get experience. So Celia's been doing it for a while, and she comes in and she sees what I do. I show her stuff. She learns stuff. So it's a very hands-on thing. If you like hands-on things, this is for you. If you don't like a desk job, this is for you. If you like seeing the same people kind of every day until they get better, this is for you.
So she's shadowing you right now?
Yeah, she's just watching me do stuff. And you guys know I see you every day. You see my beautiful face every day. And if you don't like that, then maybe this isn't for you. Especially like I do a lot of talking to parents, sometimes angry parents.
What do they get angry about?
If I tell them their son or daughter has a concussion and they don't want them to be out of sports, that can make them angry. So you have to be very well versed in these things, be confident in what you're doing. You have to be very knowledgeable. You have to continue learning, okay? So that's what goes along with that. So where do we work? So everyone sees an athletic trainer run into the field, right? You guys know that. But they also work in different settings like performing arts. I have an athletic trainer friend. She works with cheerleaders. She works with competitive cheerleaders. That's all she works with. Do you know that the Pittsburgh Ballet has an athletic trainer? Because they get injured all the time. They have a lot of foot injuries. Brace fitting, so when you go to the doctor, you need a brace. Athletic trainers do that. Military, the military hires a ton of athletic trainers. First of all, we're a little bit cheaper than PTs. And the second thing is we know how to deal with athletic injuries and what you do during your military training, like the push-ups, the sit-ups, running. All those are athletic injuries. Okay, and then I did this for a period of time as a physician extender. It's working out of a doctor's office. I casted people. I pulled out stitches. I pulled out staples. I called patients. I refilled medicine, all that kind of thing underneath the doctor. So, And then in the industrial setting, I've also worked in this type of setting. You work with people doing a physical job. Boeing, the airplane manufacturer, hires a lot of athletic trainers because those people putting together the planes do a very physical job. So we work with an active population. It could be a 50-year-old or it could be a 13-year-old. So we're trying to do that.
Do chiropractors hire athletic trainers?
Sometimes, but our fields are a little bit different because we work more with PTs and doctors because they're alternative medicine, but athletic trainers can work with chiropractors. They can. Okay, so this was just an advertisement. As you can see, we don't work with just the hockey person. We work with swimming, we work with military, we work with football, and we work with older active adults. So, what do you guys think my day is like? Do you think it's busy or do you think it's like easy? Okay. Well, if you like to sleep in, sometimes that's a good thing if you want to work at the high school level. But so like September through May, I have clinic 2 days a week. And then I assist the PTs and PTAs showing patients their exercises, hooking, well, I help hook people up and do patients rehab.
Do you all know what PTs are? Because I know we have kids in grades 9 through 12. So anybody
Okay.
anything? No. So
Physical therapists, if you get an orthopedic injury or like a cardiac injury, a head injury, they do physical therapy with you, which means they do exercises to help you get better. So that's who I work with. So high school, I could be here, like I think Saturday I was here until 10 o'clock at night. It just depends upon when the practices and games are situated. This is during the week. During Saturdays, like they could have practice or games at any time, same with Sundays.
what's clinic when you say from 9 to 1? Is that just whoever-
Clinic is the physical therapy clinic. Does that make sense? I'm sorry, I'm using lingo. And then travel. Bob travels to every football game, and then we only travel when they make playoffs. So if you work a collegiate level, which I'll get to that, if you work in the collegiate or professional setting of performing arts, you're going to travel a lot. My friend that works with the cheerleading, they've traveled all over the world. So she's like 28 years old, and she's seen the world with her dance company. But she doesn't get to be home very much. But she loves it. Collegiate and professional, when I worked at Slippery Rock for a period of time. I would get home at 2 a.m. from bus trips to away games with my men's basketball team. So it just depends upon what setting you're working at and who you're working with. Okay? And then August camps, you guys know that because I was there for you. It was long, but I like it. So, and when I worked in an industrial setting with older people that did physical jobs, I'd have to be into work at 5 a.m. because that was when the shift changed. So it just depends. And then brace fitting and working with doctors, athletic trainers that work with doctors, you have typical hours like a doctor's office hours. So I'm going to show you these 2 videos. See if is anyone here really queasy when they see injuries happen? Okay. If you haven't seen these before, okay. Okay, I want you to pay close attention to this part of the screen. Oops, sorry. Oops, wrong part of the screen. That was the other one. Hold on. I'll go back. Okay, this is a Kevin Ware injury, okay? Look right up here. Do you see his bone sticking out?
No.
Okay. This is the best video I could get of this injury, but this was a really rare injury, but that's why we're here. Okay, so watch him up here.
Okay. Yeah.
Do you see his bone sticking out? He broke both those bones. If you see his teammates' reaction and the opposing team, they're like totally grossed out. Part of our job is to remain calm in these situations, calm down the athlete, get the whole team and the coaches like calm down. Okay? He's actually back playing basketball now. He fractured both these bones in his leg and it just snapped in half. Came up for a jump shot, snapped in half. And that's what we're trained to deal with. If you don't like emergency situations, I would not say this is for you. You need to be calm, you need to calm everyone, and you need to get it, you need to know the process steps to get help or the process steps you need to go through to get the person the help that they need. So that was that. Now this injury, okay. Did anyone, this is when you guys were really young. This was back in 2006, but I remember watching this. I'll show you where it is. He goes up down here for layup. Watch his leg. Okay? So I'm expecting, but I need to be aware that that could happen during a game and how I'm going to deal with it. What if someone goes into cardiac arrest? They have heart problems. How am I going to deal with that if someone has asthma? So that's why we're there at all the games. He dislocated his entire knee. He tore 3 out of the 4 major ligaments in his knee. So that's what happened with him. He's better. He's okay now, but he had to go through intensive rehab and surgery. Our growth rate is around 19%, so it's higher than the national average, around 11%. Our wages are a little bit higher than the rest of the country. Without telling you what I make between $30,000 and $40,000. The more years you spend in it, the more money you make. So when you start out, you typically get paid around like $30,000. Okay. If you work at a collegiate level, the chances for pay are higher, especially if you're at like D1 or D2. Professional, they make really good money. But does anyone watch Steeler games? Their head athletic trainer, he makes like probably $120,000, but he's there like 120 hours a week. So if you make more money. Yep. Pretty much has it. Yep. Minor league teams have them too. So if you like working with sports, it's right up your alley. Almost every sport has an athletic trainer. And then we're one of the higher employing states. As you can see, this is like the most recent statistics. So we hire a lot of athletic trainers. I guess Colorado doesn't, or Wyoming. Yeah, Wyoming doesn't hire a lot of athletic trainers. I don't know. Their population is not that much. But, okay, so we're going to do something. A little bit of an activity. Has anyone gone through rehab or therapy here? Okay. I want you to break up in groups of like 2 to 3 people. Make sure everyone's included. I'm going to hand you an object, okay? I'm going to hand you an object, okay? I don't have a lot of supplies here at the high school, okay? Like a therapy clinic would. So what I have to do is use my knowledge and my imagination to create exercises to help people get better, help their muscles get stronger, help them heal quicker. So I'm going to hand you an object, and I want you to think of ways that this can be used to help in therapy to get an ankle sprain better. Okay, because ankle sprain is pretty common, okay? Now, you already know that, so don't tell anyone. Okay, guys. Yeah, we're going to give it a couple minutes. Think of what... Okay, you two guys have this. I'll give you the...
You can get up and move around.
You've been...
What you do.
Yeah. So I want you to come up with exercises you can do.
Building blocks is not part of your PWA.
You haven't seen that yet, so... Okay. No, you form 2 different groups.
To go through injuries. If you have a sprained ankle, hold on to the wall, take the bad ankle, and do an exercise to
Okay. Kind of reminded me of when my dog had surgery.
They're a little bit tripped up. So, what exercises work your ankle? That's what we're going to go with. What can you do to help someone get better with an ankle sprain?
Oh, we're supposed to do something better with ankle.
With an ankle sprain.
Ankle, yeah, your ankle. Okay.
He had a good suggestion over here. He was talking about setting up some kind of like an obstacle course.
An obstacle course. Okay.
Or like where you have to go through the cones. Is that what you're saying?
How about let's do this, okay? Why don't you come up and show us your idea and show us how it's going to work? So if you guys have time to talk about it, once you're ready, come up and let's see how you guys get it to work.
Yeah, go with them. Come on.
I need some team support.
Yeah, team
So, you're gonna like.
Okay. So, you guys want to watch this? See what he has. Would he come up? What's your name?
Jake.
Jake. What's Jake come up with?
So let's say this is my bad ankle. Maybe I want to do something like to get it stronger again after it starts to heal. Get it through like the cones and like a figure 8 type of thing.
That's very good. That is a great exercise. Another thing you can do, I'm showing you guys a little bit of introduction. That is awesome. That's great. You can set them up if you have an athlete with like a soccer ball or something. What I've done in the past, for if they have an ankle bruise or something, is I'll set the cones up and they have to dribble through the cones with a soccer ball. Or, like that was a dot mat like drill. You can do this, where I can have them reach down and grab the cone. So, do you see, we have really cheap equipment that does a lot of things. Think of anything else? That was really good, what you did. That was very good. Anything else you guys can think of? No? No. Okay, we'll move on. Kelsey, you want to do your foam pad?
Thank you, guys. Keep it elevated. There you go.
So again, we have a lot of really inexpensive equipment, and we have to take it and kind of think like how we can use this to make the ankle better after an injury.
You can practice balancing on one foot.
Balancing.
You can do toe raises.
Yep.
Let's see what we come up with this one. Like toe touch things.
You can do heel touches. Yep. That's good. We also use this for balance when we concussion test. So, but I said ankle, so good job.
So if somebody has a concussion, how is their, is it different as far as the amount of time they're able to balance?
Yeah.
Guys, listen up, please.
Concussion stuff is very different. I didn't have enough time today, but some other time if you guys want to stop down and look at it. I have this iPad. It seems like a game, but it's really concussion testing.
Do you need a baseline first to compare it to?
Yes. Yes, they can go by percentiles, but it's generally recommended that you get a baseline. But concussions are a little bit of a different monster, if you know what I mean. So what do you guys think of with a towel?
Tied around the ankle.
Tied around the ankle?
Yeah.
Okay. How about this? You want to hop up on the table? I want to show you. How about?
That's all we have.
You can do a couple of different things with a towel. This towel probably costs like $5, but no, sit on the table, not stayed on the table. Oh. Okay. So like say this is your ankle, okay? I'm going to put it around your foot. You can do a stretch, okay? If I want his foot to get stronger, he can push his foot this way and I can hold against it, okay? We can also do, which does relate to your ankle, I can have him stand. You want to take your shoe off for a second? Since your game, right? Okay, what I'm going to do, okay, let's have you stand over here. You guys can see this. Hey, I fell off again. Put your foot not on the towel. Okay, I want you to scrunch the towel backwards to you, starting at the edge.
Can't do that. It's like impossible.
Yeah, you can.
How do you do that?
It takes a while, but that's some of the rehab.
Yeah, that's a good one.
Okay? Okay. Who wants to go next? How about, yeah, Matt, Zach? Oh, this keeps falling off of me. Okay, you want to come up and show? You don't have anything. Okay. Does someone want to be game to demonstrate?
Jonah does.
I got this.
You want to do it? You want to come up? Okay. So what I have people do for ankle injuries, and this still works your ankle. Are you okay with taking your shoe off, or? I mean, it's probably not smelly, right? No. Okay. Okay. You want to sit down in the chair? Okay. What I have people do, okay, you can take off your sock too, if that's okay. We'll just put you a couple pieces. This foam costs like nothing, okay, because we had it. It was leftover scrap pieces. Okay? Yeah. So you work your ankle. You work your ankle by picking them up with your toes. You want to go ahead and demonstrate?
I got it.
See, it's hard. So it's challenging, but I have very little equipment that I can use, but we're thinking of new things to use with it.
No, is it just your big toe that you're using to pick it up, or? can you use?
You can use all your
All your
toes.
toes?
So if you injured a toe, this could be an exercise, or your ankle because you're moving your ankle while you're picking it up.
How long would they do that?
I usually have them do like 2 containers worth or something like that. Who else? What about the last one, the BAPS board? What do you guys think about that one? You know, come up front. Okay. What do you guys think of this? This was the most challenging one. I mean, so what do you guys think about this one? What does this one do? It's for an ankle injury? Yep. You can do circles with this. You can do back and forth. And depending upon what type of ankle injury they had, I can move the little round thing in the back, and I can do it with his other foot, things like that. You can also have him sit and do this. But this is called a BAPS board. This is another inexpensive piece of equipment that we use for a lot of things. So if you want to try it out, we can try it out at the end. So a couple more things. I'm gonna talk about this while I pass out some stuff so you guys can take a look at it. We do a lot of taping and use a lot of supplies, so I'm going to pass around different kinds of tapes so that you can look at it. For those of you that are athletes, this is like nothing new, but
I'm just curious, how many of you in here are
okay.
Okay, or you played sports? So we've got a lot of athletes in here, some potential
As now.
children share.
Okay.
Share.
Yeah, here.
Look at it.
That's another one. So I'm going to finish up while you guys take a look at the tape, pass it around. We use tape for different things. It depends upon what we want. Do we want a lot of movement? Do we want some movement? Do we want to tape an ankle?
Ladies and gentlemen, I need you to give her your attention. She has taken her time to be here, and you need to be respectful, okay?
It's okay. If you guys look at the tape, like again, we use it for different things. What body part? How much motion do we want? That tape you have over there. And this is things that we're taught. We're taught in a taping class, a bracing class, on how to do it. That one is very sticky tape. So I only usually use that unless I don't want something to move. But well, you guys look at that. So responsibilities, I come in. We cover practices, games. You guys are supposed to fill up the water. But we also bring ice with us. We treat injuries and we rehab injuries. This is what I wear, okay? So tennis shoes, khakis, and I typically have the Bethel Park logo somewhere on my shirt so that when people go to a game and stuff, they know it's me because I'm the one wearing the khakis. So it's pretty typical uniform.
To have khakis?
Yes.
Trainers?
Yes, very standard. As far as like advancement goes in our profession, you can advance. I mean, I did. I worked at the D2 level from, for a while from working in a physical therapy clinic. It just depends upon how many hours you guys want to work and how much money you want to get. Another thing is, I'm just going to point this out. If I was talking to an athlete and it was kind of like what was going on here, my boss would like kill me. Because you have to pay attention, focus, you have to listen to what the athlete's saying, you have to pay attention to what the parents are saying to you. You have to be good at talking with people, okay? So if I was talking to a parent and someone else comes up to me and starts joking with me, I'm like, hey, that's not very respectful to the parent who's taking their time out to talk to me about their kids. So that's another thing. I would recommend, if you want to, you can come down for a day, see what me and Bob do. If you don't like it, we're down the 3rd floor, so the locker room's next to the swimming pool.
Next to the swimming pool?
Yeah. There's a lot of difficult times we have on the job. One was if you see an athlete out for a long period of time, it does affect us. I do feel really bad. Or if an athlete gets severely injured. I had one girl who fractured her neck. She was out for 8 weeks. We had a spine boarder. So spine boarding, you lay on the ground and the ambulance has to come. Wow. So that really affected me. That was challenging. I had another girl that wasn't breathing. And because I work with you guys every day, it gets really challenging because you know the person and you're performing CPR or
Was that this year or
No, that was in the past.
In the past.
So she was okay, but still. And as far as traits, like I said, listener, good at talking with people. You have to be responsible. Say, for instance, like my boss doesn't keep tabs on me. If I didn't show up to my job, that's like really irresponsible. I have to be motivated to help you guys. So if I'm not motivated to help you guys, it has to be like internal. Do you know what I'm saying? Because there are some athletic trainers out there who don't give a crap, but I actually care. Like, I want you to get back. I want you to get healthy. I want you to play at your best. So, does anyone else have any questions?
How many of you are still interested in going into something like this now? Okay.
No.
So, I mean, I think it would be a great career. Hours are somewhat unpredictable.
They are, but you can manage it, especially if you're a girl. Not talking probably with the boys. But if you're a girl, you can manage it with a family and stuff like that.
Okay.
You gotta even out your time.
Right.
So you gotta be good with time.
All the tape that you pass around, some is a lot stickier than others.
Yeah.
To rip this one. I can't rip this one.
That one doesn't actually get ripped. That gets cut.
That one gets cut.
See? So we learn all the types of tape and how you tape a body part.
Right.
So the athlete, it aids in their performance. It helps them get better. What about you guys back here? You have the white tape. Because that everyone knows the white tape. This tape, I only use if I want it to stick in place. Like, I'll do it on knees if someone's kneecap is moving around too much. How about, you want to show up that one, Matt? That tape, that's called KT tape. It aids to help muscles function. It aids to help fire muscles. It's a different kind of tape. It lasts for 3 to 5 days on someone. This one, I used before tape. It's called pre-wrap. Girls put it in their hair. That's not what it's intended for. But you use it under the white tape so someone doesn't get burned from the tape when you take it off. This one, Bob uses a lot for football season. You guys want to feel this one?
I've had this wrapped on my groin before.
Yep. Bob uses it for ankles a lot. I don't really like using it, but that's just my personal preference. You guys have seen these right before. Ace wraps, groin. This would be a good one for your groin. Things like that.
Okay, so I have a question. Now, you know how they say, gentlemen, the rice, how they say to rest,
Rest.
and compress,
Yep.
and elevate, and so on. When should you use heat versus cold?
Good one. Okay. Let's take the example. Ankle sprain, guys. Do you think you should use heat or cold? Did y'all have to answer?
Cold.
Why do you think you use cold?
Isn't it something with the muscle? If it's like a muscle.
Yeah. That's kind of what you learn in your classes. Why am I using heat? Why am I using cold? If I put heat on an ankle sprain, it would balloon up. It would be bad. But if I put cold on it, it decreases the swelling because your blood's not flowing, right? Your blood's not flowing as quickly down to that area. And so what ends up happening is a person, because you have less swelling in that area, you're able to move your ankle better, right? So I can do therapy with you quicker than if I put heat on it. If I put heat, it's going to balloon up. You can't move your joint because of all that swelling. That's why we use cold. Backs are a little bit different, but for everything else, right after you get injured, if you put ice on it right away, it prevents secondary injury to your cells and your muscle tissue. So that's one of the things that you learn right away when you're in athletic training classes. So why am I doing this? What am I doing it for? How am I helping out the athlete or the person I'm working with?
Are sprains worse than breaks in some cases?
Yes. Bone actually heals pretty well. It has a really good blood supply. Sprains, the ligament tissue does not heal very well. So you'll see people, have you ever seen someone who can do all sorts of crazy things with their ankle or sprains it a lot? That is typically worse because they have, it's called chronic ankle instability, rather than someone who breaks a bone and 8 weeks later their bone is healed, it healed very well, and then they can go back to playing sports. So sometimes sprains are worse than breaks. Same with knee ligaments. Sprains of ligaments in the knee can be worse or not as bad as breaks. It just depends upon how badly you sprained it. With spraining, does anyone know the difference between a strain and a sprain? No? Strain is muscle, sprain is a ligament. And in anatomy class, has anyone had anatomy?
Anatomy and physiology, Mrs. great class to take. Yeah.
Like tendons connect your muscles to your bone, and ligaments connects your bone to your bone. So,
So you
if anyone's wondering.
got all of the bones and the muscles.
Yeah, if you don't do well in anatomy class, you're really not going to do well in this. So if you don't like anatomy, then I wouldn't recommend it. I love anatomy, so that's why I went into this. So, anyone else have any questions?